Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, July 20th for British Columbia. We're honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Tomorrow morning, I'll be doing a briefing on the first month of our surgical renewal plan with Michael Marchbank. Tomorrow at 3 o'clock, we will be presenting a written statement. And with that, I'm honored to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So we have a number of things on the agenda today. To start with the case updates since Friday. We have 3 reporting periods. Between Friday and Saturday, we had an additional 51 cases in BC. From Saturday to Sunday, 19 cases. And from Sunday to today, 32 people who tested positive, giving us a total of 102 new cases since Friday, 4 of whom were epi-linked. That brings our total number of people with COVID-19 in British Columbia to 3,300. All health authorities have been affected in the past weekend. We now have 1,042 people in Vancouver Coastal Health, 1,713 people in the Fraser Health Region, 142 people on Vancouver Island, 280 people in the Interior Health Region, and 69 people in the Northern Health Region, as well as 54 people who reside outside of Canada. And I've had some questions about that category from some people, but to remind people that that is people who might have been positive while they were here visiting, or people like temporary foreign workers who are here for a defined period of time. And that's from the beginning of the outbreak. We've had 54 people who met that category. And as I mentioned, we have had cases this weekend in all health authorities in British Columbia, which reminds us the fact that this virus continues to circulate, and as we are moving, we are bringing it with us. Although a good number of these cases over the last number of days have been related to a number of events and parties in the Kelowna area where people have moved from other parts of BC and other parts of Canada and then gone back to their home. We now have 253 active cases, of whom 16 people are in hospital, 4 of whom are in critical care ICU. We have no new deaths to report over the weekend, bringing our total to 189 people who have died from COVID-19. Additionally, we have 2,858 people who have recovered from the virus. We continue to have 3 active outbreaks in our healthcare system, 1 in long-term care and 2 in acute care. That brings our total of number of people affected in healthcare system to 657, including 401 residents and 256 staff. While we continue to have community exposure alerts, in addition, there have been alerts related to a number of air flights into and out of both Victoria, Vancouver, and Kelowna. These alerts are issued when we're unable to ensure that we've connected with everybody who might have been exposed. If you have recently flown, please check the BC CDC website, because all of the flights where there have been people identified as having COVID-19 are posted on those alerts. I will say there are no new cases at the Site C work camp in the Northern Health Region. There continues to be the 1 case related to that. And we now have over 60 cases related to the multiple exposures in and around Kelowna over the last few weeks. So also today, we're going to be talking a little bit more about the epidemiology that we've had here in British Columbia, as well as some preliminary information on the survey that people responded to. So to start with, we are going to give you an update on how and where the virus has affected people in British Columbia. So this is a weekly profile to the end of last week, where we were up to 3,028 total cases. There were 72 new cases. As we can see, the median age still is around, so that's the most common age, the median age is still around 50, and about a little over half were women. We have not yet seen that sort of change that we've seen in other parts of the country of younger people being more affected. Having said that, we know that many and most of the cases that have arisen over the last weekend and the last few days have been in people in their 20s and 30s. So I expect that number will change in the coming weeks. We had 2 new people hospitalized last week, again, a very small percentage in hospital currently. And as of July 9th, when this data was prepared, we had 186 people who had died. Again, the median age of people who've died from COVID-19 is quite elderly at 85. This is the latest epidemic curve, so that is the cases by date of onset of illness. And as you know, we've been reporting by lab diagnosed and the epidemiologically linked cases. As we can see, we've been grumbling along over the last few months here in British Columbia. We managed to flatten that curve, but it continues to grow. It continues to have sporadic transmission events in the community, and most concerning, in the last week and a half, we have seen a growth in our number of cases, particularly in young people. This is the epidemic curve by likely source of infection, and what you can tell from this is that we do know where most people have been linked to in terms of where they probably got their infection, and that is the work of the case and contact management, the contact tracing that we're doing across the province right now. And what we can see as well is there continues to be introductions from international travel, and that is sometimes essential workers coming back and forth from the United States. It is our temporary foreign workers in some cases, as well as people, Canadians, who have repatriated from other countries, including more recently India. The other important thing to note in this is that we are starting to see people who are testing positive in the last few days having a large number of contacts again. Early on, before we put in place our public health measures, we had people, every case had on average 11 or 12 contacts. Now we're starting to see that coming back, which means we're having increased connections with people in the community. We knew that would happen as we moved into this phase of our restart here in BC. But the challenge now is that we are no longer having safe connections. And that is what is spreading this virus. So we are having clusters in certain environments where people are transmitting this. And these are mostly now we're seeing parties, small groups, people going together to restaurants and bars and clubs, but also in houseboats, in resorts, at private homes. And the challenge with that is we may not know the people that we're in those close contact with. It's often outdoors or a combination of indoors and outdoors, but spending that time together with people and then mixing, so it might be a small group one night and then a different small group the next night. And those are the situations where we can pass this virus on. And it's very challenging for our teams in public health to find all the contacts in a timely way. So that is something we need to pay attention to, and I'll come back to that. Today as well, I wanted to present some of the data around people who unfortunately have severe illness and die from COVID-19. This is a challenging information because it's not at a population basis, but it is what we call case fatality. So those people who have tested positive or who have had the disease that we know about, and the different settings where people have been exposed. So overall, and if this data goes back to July 9th when we had 183 people who had died, out of the 2,978 cases that we had reported at that time. So that gives a case fatality rate of about 6%. But if we break that down, we know that in some situations it's much more dangerous and much more lethal. So non-outbreak cases, so those are people who are infected in the community either through travel or through individual connections. We've had 50 people in that category who've died. But so the case fatality rate is about 2.6%. still much higher than we see with influenza, for example, but much lower than certain scenarios. When we look at our outbreaks, and so we've had outbreaks that have occurred in healthcare settings, both long-term care, assisted living, but also in acute care. So that is hospitals where we've had outbreaks on specific units. We had hospitals where we've had outbreaks in the ICU, on certain wards of certain hospitals. And so if we look at those situations, our case fatality rate in long-term care assisted living is very high. So we know that about 1 in 5 people who are infected in those situations will die from COVID-19. This is one of the reasons why we have put so much time and energy at trying to protect our long-term care homes and our elders and seniors in those situations. The same can be said of outbreaks in acute care. Although the numbers thankfully are smaller, again, it's a very highly lethal situation because we know that people in hospitals, particularly in ICU, are people who have other underlying illnesses that put them at risk of having severe disease if they catch COVID as well. And finally, we've had other outbreaks. So these would be community outbreaks like the conference, a large conference early on, where we had a person who was infected at that conference and died, as well as things like our temporary farm worker outbreaks that we've had. And in those situations, again, much less risky in terms of having severe illness or dying, where the case fatality rate is less than 0.5%. I also want to bring us up to date on our modeling so that we know where we are in terms of keeping our curve flat and where we need to be moving forward. So this is the update of the dynamic compartmental modeling that we have shown a number of times. What we can see from this, though, is that we're starting to see an upward bend of our curve. This is where we have wanted to make sure we continue to keep our curve flat, that we keep our contacts safe even as we increase the numbers. What this shows is that we do have a possibility of having explosive growth in our outbreak here in BC if we're not careful in how we progress over the summer. I will say as well, though, as we said last time, we are thankfully still having small numbers of cases per day. So this is what we call unstable, which means that the confidence intervals, that sort of pink broad area, is quite wide. What that says is we still have it in our hands to make a difference on bending this curve. When we look at things called our reproductive number, so how many people we transmit this virus to if we're infected, and we can see again it has risen above 1. That is concerning because that's a level at 1 is where we can stop the outbreak. So we are at a place where we could see rapidly progression of transmission of this virus if we're not careful. This is, again, the modeling the scenarios that we have shown in the past. And what it talks to is what we could see if we make those changes that we need to think about now. We are probably at the rate of 65 or 75% of normal pre-COVID contacts. And we run the risk of having a rapid rebound in new cases. We are starting to see an uptick. This is concerning. But it is not foregone that we will have a rapid rebound. It is something that we can make a difference in if we pay attention now. This is a slide that shows the Sero survey that we presented on Friday. And what it tells you is that fewer than 1 in 100 of us were infected with COVID-19 over the past few months, up until May. This is good news. This tells us that the things that we did made a difference and prevented people from getting sick. And we need to pay attention to that in our interactions now as we continue on our restarting of our economy and our community here in BC. Now I want to move on to the survey that we presented, or that we completed a number of weeks ago. It's called the Population Health Survey, Your Story, Our Future. And this is just an overarching snapshot. This is a large database. Many people participated, and I'm going to give you a sampling of the types of how representative the sample was of the population here in BC, and a couple of the high-level things that we've looked at so far. There is much, much more to get out of this survey that is going to help us in understanding what we need to do to continue to progress through this pandemic in British Columbia. Essentially, 1 in 10 adult British Columbians completed the survey, and there was over 394,000 people who completed the survey. This included people from all areas of British Columbia, slightly underrepresented from the north, but there's things that we can do statistically to help make that a representative understanding of the responses. This is some data now that tells us the difference between the people who responded to the survey and our population in British Columbia. So it tells us, is the people that responded similar or different to our population? And then it gives you an idea of what we can do statistically to weight it so it is representative. And with the numbers that we've had, this large database, this allows us to be able to compensate for areas that we may not have had as many people respond. So as we can see, about 70% of people who responded were female. And our population is actually a little bit more evenly balanced. But we can weight our sample to be able to understand how that impacts the people's responses. We are pretty well balanced compared to the BC population in terms of age of people who responded. And we were a little off in some areas around race and ethnicity, whether somebody was a visible minority or not. And so we can compensate for that to ensure that we hear the voices of people from different ethnic and racial groups. As well, we have looked at indicators like income and education, as this helps us understand what we call socioeconomic status and how that affects people's experience both with COVID, but particularly with the experience of the measures that were put in place to stop the transmission of the virus. So to give you a few basic ideas of what we've looked at, 4 in 5 of people in British Columbia approved of the response that we had in public health here in BC. However, for younger people, this was less. Fewer younger adults felt the public health response was appropriate. And we're talking about younger adults being more differentially affected, and some of that comes out in the further data that we'll look at. When we look at whether people were following public health advice, I think it's reflected in the low numbers that we've had overall in our Sero survey that most people were taking the advice that we asked you to do and that we told you why we needed it to happen. So things like washing your hands, staying away from others when you're sick, avoiding gatherings, staying home when you're sick. And we did ask the question about, do you have the means to stay home if you're sick? This speaks to things like having sick leave at work or having a culture at your work that allows you to stay away when you're ill. And we can see that 2/3 of people did, but an important group of people did not. And we need to address what we can do to make sure that that important measure is something everybody can take as we're moving through the next few months of this pandemic. The next slide looks at where the biggest challenges were being created here from the response to the pandemic and from the pandemic itself. So we can see that a significant proportion of people in British Columbia felt that their mental health was worsening because of the pandemic, whether that was anxiety, concern about the virus, fear about losing their job, fear about being able to care for their families. And about 1/3 of people in BC reported having difficulty accessing health care, and that could be health care across the spectrum. About 15% of people were worried about being able to put food on the table for themselves and their family. And about 5% were concerned that they would likely have to move because they couldn't afford to stay where they were staying. Some of these things are reflected, of course, in the things that we are seeing in our communities, where the number of people who report being homeless or underhoused has increased. About 15% of people who responded were not working directly because of COVID-19, and we know that's reflected in the unemployment statistics. As well, 69% of people felt that there's some impairment to their work, challenges in their work related to COVID or to the measures that were implemented to try and deal with the pandemic. 2/3 of people as well were very concerned about family members and their health and the fact that they might be vulnerable to having severe illness from COVID-19. And 1/3 of people reported increased difficulty meeting their financial needs for themselves and their family. So that is just a small sampling, but we also looked at, who were the people that were more differentially affected. And what we're seeing is that young people bore a greater proportion of the mental health and economic burden than older adults. And this may in part be because the pandemic has impacted many of the occupations that they work in. So people who were age 18 to 29 and not working because of COVID-19, 50% of them, half of them worked in arts and entertainment, half of people worked in accommodation and food services, and 1 in 3 were in the retail areas. And we know that those are the areas that have been dramatically impacted by closures during the response to the pandemic. And this speaks to us as well around how important it is in our Restart program to support these areas of these sectors of our economy and of our communities. Younger people were more likely to report decreased mental health, increased difficulty accessing counseling, not working, difficulty meeting their financial needs, and likely to have to move because of affordability. 1 in 4 young people reported a health condition associated with risk for severe COVID illness as well. The other group that we've looked at quite quickly, initially in this, was families with children. And they as well report a greater mental health and economic burden than other adults without children. So worsening mental health, stress, sleep reduction, increased alcohol consumption, and concerns about financial situations in particular. So what does this mean for us? It is just a start. We are going to be looking at many other questions, and as I said, we have a plan for answering those questions that we need to help us put in place the right measures to support our communities and different parts of our communities as we move forward in this. And that will include looking at race-based data. That will include looking at data according to socioeconomic status, as well as what we have seen so far. And some of the other things that we've been looking at are people differentially affected in different parts of the province. And really, it is consistent across most areas of the province in how we are responding and what the impacts have been in different parts of BC. So we have flattened our COVID-19 curve so far, but our success has come with significant challenges, and more for certain parts of our population than others. This survey and the analysis that we will continue to get out of this survey will help guide us as we work together on approaches that balance our need to control this virus, because we know that that is a part of how we can keep things going, with the need to work, to learn, and connect with our loved ones, and the importance that that also has in keeping us healthy as a community. So there's a few important things for us to take away from today's snapshot, early snapshot. Many British Columbians have experienced worsening mental health as a result of this pandemic. I think this is a surprise to no one. Many have also experienced additional economic burden, and young people have experienced greater impacts than many others in the population. I've also been very heartened by the resiliency that we have seen through some of the survey results, and we're still in the process of analyzing them. But particularly older people Our elders and seniors have a sense of resiliency that makes me heartened for how we can support each other getting through this. The epidemiologic data also shows that we are at a turning point. We right now show some concerning upward bending of our curve, upward trends in our infection rate, our reproduction rate, and that tells us we're on the edge. We're on an edge that might go up, but is in our hands to control. If we increase our social interactions too much without doing it safely, we do risk a rebound that will impact us all. We must acknowledge that the number of new cases reported over the last 3 days is concerning. We have not had 100 cases reported in a single time period. We have been very effective public health teams in containing the spread, but we all need to do our part, and this is a warning to us. We need to be the voice of care with our family and our friends to remind everybody that we can increase our contacts, we can continue to increase our economic, our travel, but we need to do it safely, and we know how to do that. We have done that in BC, and we can go back to doing that. As I said on Friday, I'm not typically very active on social media, but I am asking you again, particularly young people, because we know you have been impacted by this. Be my voice on social media. Use your influence to share a message with your friends and your connections. Don't let COVID-19 spoil our summer. We can play safe and stay safe, and we know what we have to do that. There are a few things we all need to do to push that curve back down again. They go back to the things we've been talking about. Fewer faces, bigger spaces, using our layers of protection. Keep your groups small. Only spend time with those you know. Focus on your friends. Focus on your family. The more people you see, the more likely it is that someone will have COVID-19 and spread it to you and the people that you're close to. If you're going out, be considerate of the people who are working in those places, in the restaurants, in the pubs that you are visiting, in the resorts where you are staying. Understand that the people who work there are at higher risk because they are looking after many other people. So be kind and show gratitude as they follow the WorkSafe BC requirements for safe operations. We have COVID safety plans for a reason, and we all need to follow those rules to keep each other safe. Don't ask your server to bend the rules. Rather, help them by bending our curve. Ensure your groups are no larger than 6 people if in a restaurant or a club. No table hopping, and always, always, always stay away, stay home if you're not feeling well. If you're hosting a small gathering, remember to keep those gatherings small, know people who are coming, and stay outside as much as possible. And also, we need you to have a designated contact keeper so that we can assist you and find people if you inadvertently are exposed. We need to do that now so that we can continue on our restart program, we can continue to enjoy our summer, and we can continue to recover from the effects that we have had over the last few months. Help us spread the message to socialize safely so we can keep COVID-19 low and slow. And let's, of course, continue to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. First of all, I want to acknowledge that over the 3 days of this weekend, no one passed away from COVID-19, which is something that we, of course, are grateful for, and that the number of people in the hospital has gone down, although we all know that it's cases first often and then hospitalization, as inevitably is the case. And so we have to, we continue to be concerned about that. We'll know that from the beginning of the pandemic, Vancouver Coastal Health in the early days of the pandemic was the center of cases, and now They're essentially the same number of cases in interior health, active cases, as are in Vancouver Coastal Health, which tells us, again, we can't let our guard down. 102 cases over 3 days on the weekend in the terms, 34 cases a day. In the context of Canada and in the context of the world may not be many, but it is a lot more than we are comfortable with, and something that we have to respond to by continuing to use the tools that Dr. Henry has spoken about from the beginning. And I think that this is an important moment to reflect on and to recommit ourselves to that. In terms of the modeling today, I just want to note three things. First of all, the reproductive rate is higher than 1, and we have to, together, do something about that, because there is a point at which, if we continue to have more contacts, that the challenge becomes very significant to contact tracing. So we have to see that. And even if there were not a significant number of cases over the last 3 days, the fact that that rate is going up over the period leading into this time would be a cause for concern. Secondly, we have to understand that COVID-19 has affected everybody. There's been a lot of discussion, of course, because if you look at the statistics around mortality, we understand that it affects people with chronic conditions. Most people who are elderly are elders the most. But we also see from the results of our survey the significant impact that COVID-19 has had on young people. Other effects of COVID-19 have had on young people. And finally, you see that, I think, in a week or so, we'll be recognizing our 6 months of briefings. I think there's very few briefings where either Dr. Henry or myself have not mentioned that if you're sick, stay home from work and from school. And the fact that so many British Columbians have concerns about their ability to do that is an important finding of the survey, and all the more reason why we're proud that the Premier led all of Canada in the Sick Day initiative that has been accepted by premiers across the country and, of course, the federal government. This is an important achievement, and it reflects, I think, the real needs of dealing with COVID-19. I wanted to say a few things. I regularly update on Monday about PPE, and we'll do so today. Just to recap, since the end of March, the following PPE has arrived in BC up to last Monday, July 13th. Just over 6 million N95 and equivalent respirators, over almost 25 million surgical or procedure masks, just over 2,302,000 pieces of eye protection, including goggles and face shields, just over 56 million pairs of gloves, and almost 3 million gowns. Many of these items I've just listed are in our testing process to make sure product meets or exceeds safety requirements before being used in the BC healthcare system. Today I can tell you over the past week, we've received the following: 9,872 N95 or equivalent respirators, 1,041,000 surgical or procedure masks, 4,717 pieces of eye equipment, 6,367,000 pairs of gloves, and 535,000 gowns. Today, I would also like to respond to some of the questions we've received regarding to how much has been spent on PPE through BC's health system. As I've said previously, the international market for PPE, and by extension the cost of PPE, has been very dynamic since the start of the international pandemic. For context, I have information on the price per unit of various types of PPE, including freight costs. The information covers pre-COVID average pricing, peak COVID pricing, and pricing in the recent period. For N95 respirators or equivalents, the pre-COVID pricing, the average unit price was 62 cents. The COVID peak pricing was between $5 and $8 per unit. The recent analysis has seen that drop between $3.19 and $6.80. That's a pre-COVID versus peak difference of 6 to 10 times. For surgical or procedure masks, pre-COVID pricing was 15 cents. COVID peak pricing was between 46 cents and $1.25, and recent analysis is between 20 cents and 65 cents. That's pre-COVID to peak COVID of 1.5 to 8.5 times. Gowns, depending on the type, average unit was between 65 cents and $4.40. Pre-COVID, COVID peak pricing $2.20 to $9.65. And recent analysis has seen that drop the top part of that number. It's still $2.20 to $8.45, so that's 2 to 3.5 times. There weren't very significant material differences in the price of gloves or face shields in that time. Overall, from January to the end of June, the BC health system has spent over $114 million on PPE as a result of the pandemic. This consists of approximately $24.7 million on surgical or procedure masks, $29.55 million on N95 respirators or equivalents, $22.82 million on gloves, $16.93 million on gowns, $8.3 million on face shields and goggles, and over $12.5 million on other critical products such as coveralls and other products. And because it involved protecting people in acute care and in long-term care and protecting our healthcare workers, it was money well spent, but it was expensive. Over the next 6 to 9 months, we will need to continue to stockpile PPE. In March, when supply chains were disrupted and usage increased significantly, we filled the gap between supply and demand with our pandemic supply. This allowed us to focus on procuring more PPE in a market so extremely disrupted that no jurisdiction internationally could have adequately predicted or prepared. As I reported every week, BC has had good success. We've kept the pace with demand and made sure that healthcare workers have the PPE they need, when they need it, and where they need it. We are currently rebuilding our pandemic supply that got us through the initial outbreak, and we are also including a healthy contingency. The province has undertaken utilization modeling to help forecast demand for PPE for the next 6 to 9 months to help inform us of stockpile targets. We have based the modeling on our ramped-up surgery plans and in anticipation of a surge or further outbreaks. Over the next 6 to 9 months, our goal is to procure PPE as follows: procedure and surgical masks, $58.1 million. N95 respirators or equivalents, $6 million. Gloves, $349.71 million. Gowns, $2.4 million. These are big numbers, and these numbers will change as we receive PPE and we refine our modeling and forecasting based on what we see in BC over the coming weeks and months. In closing, the past few days have reminded us of how COVID-19 can spread, even here in BC, how quickly things can change, how rapidly anxiety can re-enter our lives in a pandemic. Last Thursday, Dr. Henry, Dr. Skoronsky, and I held a news conference to discuss BC's serology report. The study showed a successful suppression of community transmission in BC and possibly the lowest rate of infection in North America. That's a significant accomplishment and one that we achieved through our individual and collective effort and commitment to stop the spread. On Friday, of course, we reported 28 new cases, and today an average of 34 cases a day for Saturday, Sunday, and Monday. It is, I think, a sobering reminder of how fleeting success can be when we turn our back on COVID-19, when we let our skills slide, our focus waver, and our commitment slip. You cannot barter with COVID-19. In BC, our drive to bend the curve and then flatten it worked. But let's be clear, in our BC pandemic, we must not let those be our best days. We know each day matters. We know that with COVID-19, each moment of each day matters. We know that being 100% all in means remembering, respecting, and ritualizing the skills Dr. Henry and public health officials have taught us. We know that physical distancing saves lives. We know that safe social interactions stop the spread. We need to recommit right now to what we know has made the difference for us in our BC effort. There's a place for common sense, but right now there's a need for COVID sense, and to use it. Right now, using our COVID skills and making sure we're using our COVID sense matters a great deal. If we continue to remember with COVID-19, being outside has a huge upside, and that there's safety in small numbers, we'll stop the spread and we'll save lives. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle des 17 et 18 juillet, celle des 18 juillet et 19 juillet, et celle de 19 juillet jusqu'au 20 juillet en mi-journée. Il n'y a aucun nouveau décès au COVID-19 durant ces 3 périodes de référence pour un total de 189 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. À ce jour, 2858 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Pour la première période de référence, nous avons eu 51 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 19 juillet, nous avons eu 19 nouveaux cas. Au cours des dernières 24 heures, 32 nouveaux cas se sont ajoutés. Cela représente 102 nouveaux cas depuis notre dernière mise à jour vendredi pour un total de 3,300 cas en Colombie-Britannique. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up only. Please unmute your phones. You will not be audible until I call your name. First question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry and Minister Dix. It's very clear from these numbers that young people gathering is the biggest issue right now. Should bars and nightclubs really be allowed to remain open? And if they are allowed to, why not mandate mask use for bars and clubs like there is for hair salons and spas?
Yeah, I think it's a bit of a challenge to wear a mask when you're in a place where you're eating and drinking. So we have to remember that nightclubs per se are not actually open in this phase, but they are able to open to have events under the food forward licenses that we have. So it's a bit of a challenge, I guess. And yes, and we've talked about this a little bit before. I think we need to balance the impacts with the measures that we have to increase people's safety. And yes, we do have COVID safety plans, and those plans need to be adhered to. And we need to have the means to ensure that people recognize them and are not breaking those rules. And where we've seen that happen, we have closed restaurants down, we've closed some bars and nightclubs down when they have not done it. And we are working with the industry to look at how we can better make those plans safer, recognizing the challenges that we've seen. So what we want to do is look at where these transmission events are happening more commonly and look at the measures that are important to try and reduce the spread in those settings. So we will be coming out later this week. We've been in the process of looking at it for the last week with industry, with some enhanced restrictions around how nightclubs and bars operate. We'll also be looking at enhancing our inspections, both from WorkSafe, if it's a worker issue, but also public health, to ensure that the COVID safety plans are being adhered to. And we've been talking about how we can do that. The other pieces that are really important around those are, we know that when alcohol is served, that people's inhibitions tend to go away and they may forget some of the rules. And that puts the servers and the people who are working in those settings at risk as well. So we need to have boundaries around that. I believe it is better for us to work and to find those ways of doing things safely rather than shutting things down blanket, because then we know that people will be going underground and hiding things and be less likely to come forward with concerns, and we'll be having even more challenges in finding people. So some of the things that we do think are important are making sure we have those contact information for people so that public health can anonymously contact people and ensure that they know they're at risk if they are. We'll be looking at how we can use some of the apps perhaps to support that, and how we can do that in a way that gets messages more quickly to people. So that's how we've been, our plan from the very beginning has been to gradually open things and to revise and adjust and put in place the measures that address the specific issues as they arise.
Do you have a follow-up, Shannon?
I do. Asking for a colleague here. CTV News has received a photo that shows two Lower Mainland doctors attending a dinner party at a Yaletown restaurant. The photo taken July 9th shows 18 men standing shoulder to shoulder and not physically distancing. Given the outbreak in Kelowna that's tied to indoor gatherings on Canada Day, is it responsible for an ER doctor and an ICU doctor to seemingly disregard directives to the public regarding physical distancing?
Yeah, I can't comment on any specific thing, but, those are things that we tell people to be cautious about. And yes, everybody should be following the rules. And, I understand that this was an event where there was distancing and they came together for a short period of time. So these things happen. It's not, it's certainly not what we would expect and not what we want people to do. And we need to model the behavior that we're looking for in others. And I look to everybody to to not point fingers at others, but to try and do our best ourselves, and to make sure we know what we're doing, that we have our smaller groups, that we keep our distance between people who aren't in our close contact, our close connections in our bubbles.
Next question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for taking my question. Earlier today, a journalistic colleague of mine at CBC tweeted that a well-known Victoria restaurant or a Victoria grocery chain had suddenly gotten rid of all crowd control and social distancing measures. I went there because that's where I shop. I think you've been there as well. And it was near chaos. What had been a very organized store for some time with a limit of 35 people now had upwards of 65 people, no social distancing. Employees asked me to talk to management because they were quite fearful what was going on. I did. An hour later, they had put back a guard at the door when one hadn't been there, and they were back to making people line up and having a limit on crowds. Are you and anecdotally, people on Twitter, when I put that out there, are saying that's happening at other stores now, just in the last couple of days. Are you concerned at this turning point that stores now may be less rigorous in maintaining crowd control and social distancing?
Yeah, so I have not experienced that myself, but those are the reason why we have our COVID safety plans. And employees can call WorkSafe BC if they have concerns that these plans are not being followed. And I encourage everybody to go online to look at the plans of the places that they're going, whether it's a grocery store, a hardware store, a restaurant, because that is our contract with each other to keep each other safe. And so I think it sounds like the right thing happened. The people were concerned, the employees were concerned, and they went back to following a safety plan. Now is not the time to bend those rules. Now is the time where we need to continue to be careful. We know people are traveling more. We've seen that. We know we're traveling around BC. We know people from other parts of Canada are coming here as well. And we need to continue to do the things that allow us to have our economy, our social connections in a safe way. And that means that every business must have their COVID safety plan. And if people have concerns about that, your recourse is to talk to WorkSafe BC or to call local public health, and they can help reinforce that this is the time we need to follow these. We need to bend that curve back down.
Do you have a follow-up, Keith?
Oh, that's good. Thank you very much.
Thank you. Next question comes from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Through many briefings, off and on, you've discussed the reproduction rate, the R number, and I know a number of occasions you've said that the threshold, if you can get it below 1, that's great, and if you start going above 1, you're worried. I assume it's headed in the wrong direction at the moment from the numbers you've given us today. Are you confident you can get it back down without reversing direction on sort of allowing relaxation of some of the restrictions out there, or are we going to have to go back, head backwards for a while?
Yeah, that is my constant worry. It is modeling, so it gives us an indication of scenarios and what could happen based on the data that we have. And yes, we've been skirting 1. We've been up and down around 1, and we know that what the reproductive number is how well we're doing at preventing that next generation of cases from arising. So it's how many people I spread it to. And this is all connected to our ability to do contact tracing, to find people who are at risk, who have been exposed. We know there's nothing that we can do to stop you from getting sick if you've been exposed. And what we can do is prevent you from spreading it to the next generation of the people that you're close to. So during that incubation period, keeping you away from others so that if you do become ill, you won't spread it to anybody else. And that's how we get that reproductive number down again. So how do we do that? We do that effectively by keeping our contacts smaller. We know now that we're traveling more, we're going to work, we're going to different settings. So we are having contacts with more people. What we need to do is have those as safe contacts, which means keeping our distance, making sure that we have our numbers small, and if people do get sick, making sure we can find them quickly. We know how to do that, and we have public health teams that are doing that now. There are hundreds of people who have been exposed over the last few weeks, and we are connecting with them, and we need your help to continue to do that. And that's how we get that number down again. We know what we need to do, and we know we have the means to do it here in BC. So I am confident that we can, but we need to pay attention to it now.
Do you have a follow-up, Bon?
Yes, please. On Friday, when you were discussing the Kelowna outbreak or the Kelowna cases, there were 35 at that point, and you said that there had already been first-generation cases and then second-generation cases, and you were waiting for numbers on third. We're up to 60 cases there now. I guess the first question is do you have any sense that that's contained, and is it what has been called elsewhere a super spreader event?
Yeah, so probably not. Super spreader events tend to be where a single person or two people are in an environment where they spread to lots of others in one generation. And there's a number of reasons why that can happen. Someone can be very sick and have a lot of virus spreading, or some people we know for reasons that we don't know and we can't predict ahead of time are super shedders of virus and can be very effective at spreading it to others. This is again the balance of why we keep numbers low. So even if you are somebody who's shedding a lot of virus, if you can't spread it to lots of people, you are not going to get one of those super spreading events. And this is, we're at that really challenging time. But what we have seen with this, with the Kelowna outbreaks, are a series of parties, small groups that intermingle, so people in one group one night, a different group another night. And so it's not been a single super spreading event that we've seen in some other places, but it has been a number of events where people have spread to a number of other people, and then they've gone on and had other large numbers of contacts. And as I said, early on in this, the average number of contacts that a case had was around 11 or 12. We're back up there now. We had brought it down to 3 or 4, but now we're seeing people who have contacts, 20 or 30 contacts, and that puts the pressure on us in public health to find those people and to notify them, make sure they know what they need to do. And quite frankly, people are a little bit tired of all of this. They want it to go away. I think I want it to go away. But we have to live through this and be able to live our lives. And that means we have to be cautious. And we need to take those precautions. And if we are somebody who's been exposed, then we do need to take those measures to stay away from others so that we're not passing it on inadvertently.
Next question is from Farhan Lalji, TSN.
Hi, Dr. Henry. Just wanted to touch base and ask about amateur sports and a possible transition from phase 2 to phase 3. I know that sports are still sitting in phase 2, and if you had a sense of the timeline around that.
You've caught me off guard. I actually not sure where we are. I know some sports have started already, and some of the summer leagues are working. I've seen some of the COVID safety plans, but I don't have a single answer for that across the board. But I can find it.
Do you have a follow-up, Farhan?
No, that was it.
Thank you. Next question is from Lisa Houston, News 1130.
Sorry, I had to get it off mute there. I'm wondering, you mentioned about the super spreader, but on a level of 0 to 100, where is your level of concern right now? Because I have to say myself and others, I think are on a level of holy, fill in the swear word of your choice right now.
Well, how about I'm at 102. That's my level of concern for today. It's so hard to know. One thing that we have learned is that we can't predict what's going to happen, and we are reacting to what has happened over the 2 weeks, 3 weeks, particularly since that July 1st week. So we're past that first incubation period. We're starting to see people getting sick in the second incubation period, and this is the second generation of transmission from events that happened over the last 3 weeks. So we don't know. We know that there are people who have been exposed, and there's several hundred of them now who are in all health authorities in BC. Many of them were connected to Kelowna. They've gone back to where they lived, either in Fraser or Island or other places, and some of them will get sick. So we'll see more cases in the next couple of weeks. But the challenge and what we can do is stop those people from exposing anybody else. And that's where we are right now. We are at a bit of a tipping point. We now have started to see cases increase. Our curve is bending up. We know what we need to do to flatten it again. And that is make sure that if we are exposed, that we stay away from others until we're through that incubation period. Get tested if we have any symptoms at all, or if we've had a high-risk exposure. You know, even if you're uncertain about whether you're feeling exactly well or not, and you've been at one of these parties where you know people have been sick, it's okay. We will test you. But you still need to stay away from others during the incubation period. Now we can contain this, but we need people to be aware of it and to take those prevention measures that will stop that next party from happening where somebody inadvertently brings it in and another group of people become ill. We need to do that now because we know the more people get ill, the more chances even young people will have severe illness, will end up in hospital, and unfortunately some people will die. We also know that young people work and we have families and we have other connections in our lives, and we will get spillover, as we have seen in the past, either into hospitals, into long-term care homes, into other areas where other people at risk may be. And that's what we need to prevent now, and we have the means. We know how to do it here in BC, and we can do it.
Do you have a follow-up, Lisa?
Yes, one of the things I noticed in the responses to the survey was it was around 70% people saying they were able to stay home when sick, but it was 10% less than that of people saying they were actually staying home when sick. That seems concerning, and I'm wondering, do you think that the message isn't getting out there? Was this earlier when people were worried they weren't going to get paid? I'm just wondering what is being missed there, because you've mentioned many times that is key to us staying low and slow, as you put it.
Yeah, and I think it's a combination of things. So it talks about people's agency and ability. So part of it is physical ability. Do I have a home to stay in if I become ill? Or what is my living situation that allows me to do that? And the other part of it is, do I have a sick leave? Am I allowed to stay away from work if I'm sick? What is the culture in the place that I'm working? What am I going to do if I don't work and I don't have an income? So it's addressing all of those, and I think one of the important things that we recognized early on, and the Premier advocated nationally for, was making sure that at least during this period we give people the means to be able to stay away from work if they're sick, and that's having sick leave for everybody supported. That's really important because we heard that over and over again. There's also a culture in many places, and in healthcare more than many other places, of presenteeism. If I don't go into work, it's going to overburden my colleagues, and we minimize our symptoms and say, oh, well, it'll be nothing. And we've seen that happen, and that's a challenging thing too. So we need awareness and increased awareness for people to stay home.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released shortly. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. Last question is from Tanya Fletcher, CBC.
Thank you. Dr. Henry, you said we are at a turning point. We're on the edge. So will anything change other than more urgent messaging, perhaps if we see our curve continue to go back up? And if so, what's the timeline or the parameters for what it could look like on the other side of that tipping point?
Yeah. It's not an easy question to answer. So yes, we are in the midst right now of looking at what are the measures that would make a difference in those high-risk settings. And right now, there are things like nightclubs and bars and pubs and restaurants. We're looking at those. We're looking at, where are the settings that these parties are happening, where people are in close quarters with people and inside often. And they're often at resorts or rental properties, or we know, particularly in the interior, renting houseboats and boats are a popular thing. Can we put in measures that put the onus on the rental agency to ensure that these types of parties aren't happening, or that numbers are smaller, or that we can work together to put in place the restrictions that we need? So we're looking at a whole bunch of those things, some of which will come into play this week. Others may take a little bit longer. What we are trying to do, and what we have done from the very beginning here in BC, was to take the measured approach so that we don't actually have to go back. We don't want to be going back to closing things down unless it's absolutely necessary. So what we need to do is look at what are the measures that are needed across the province to address the risky situations that we're seeing, where we're seeing transmission. And so that goes back to, enclosed spaces with poor ventilation, where we're having close contact with large numbers of people, with crowds. So there are things that we can do to increase the space, increase ventilation, increase responsibility of people to follow their COVID safety plans. And those are the things that we're looking at now.
Do you have a follow-up, Tanya?
Yes, please. So if the root of the concern is we're increasing our connections in unsafe ways, do you think people, first of all, aren't following the personal bubble rule of up to 6 people? Has that messaging been lost? And could that number change? And could we get an answer from Minister Dixon-French, too? Thank you.
I do think we are having larger numbers around us, and that's one of the things that we're seeing with this clusters of cases that we're seeing coming out of linked to these parties in Kelowna. So yes, we've expanded our bubble, and we want to take that into those inside places like restaurants and pubs where we know it puts people at risk, including the people who are working there. So those are the things that we need to find our balance again. We're traveling more, so we're going to different communities, and we are sometimes that makes us lose sight of those measures that we're used to doing in our own home community. We have people who are traveling here from other provinces where they may have had different challenges and different messages. So we need to all work together to know. I mean, the one thing we have on our side is that we do know that when we do these things, it works, and that we can have safe socializing. We can play safe, and we can stay safe, and we can have those connections that we so need. We have those, the social connections, but also we can continue to have our economic restart. We just need to make sure that we're doing it slowly and thoughtfully, and with consideration of others and how we're impacting them. And I know we can do that.
Et je pense que les conseils n'ont pas changé, pas du tout, mais il faut à nouveau, pour tout le monde, suivre les règlements, suivre les conseils, et c'est absolument important maintenant, comme au mois de mars, comme ça va être au mois d'octobre, c'est-à-dire qu'il faut être prêt à suivre ce qu'il faut faire pendant cette période, pendant les mois à venir, même dans l'an à venir. Et ça c'est difficile de temps en temps. Mais les conseils ne sont pas changés. Il faut un renouvellement de notre effort collectif à suivre ce qu'il faut faire. C'est très simple. Il faut quand même que des gens comprennent, je pense, qui va souffrir, où sont les dégâts si on lâche maintenant. Et je pense que les dégâts sont évidents. Il y a maintenant un centre de soins dans toute la province, Holy Family, qui est dans une période d'outbreak active, n'est-ce pas? Seulement un. Mais ça peut changer si tout le monde ne suit pas ce qu'il faut faire. Donc c'est un moment important. On est toujours en bonne position relativement, mais maintenant c'est un grand moment, un point qui a la potentiel d'être un point tournant. Et donc il faut absolument continuer à suivre les conseils du Dr Henry, les conseils de la santé publique, et c'est absolument essentiel cette semaine, ce week-end prochain et dans les semaines à venir. Merci beaucoup. Thank you very much. À la prochaine fois.
Thank you.